I have type 1 diabetes, which is insulin dependent, and I was diagnosed 2 years ago on the 11th of January. No, I didn't know what it was. I didn't know anything about it. But even when I only really knew what it was when I was diagnosed. So I hadn't a clue what it was before. I didn't even know I could get it.
I was diagnosed when I was 13. The doctor diagnosed me as I was drinking a lot, running to the toilet. I'm type 1 and it's controlled by insulin.
They did glucose tolerance test. So then they said it was at the borderline, but I had to be under continuous monitoring and be aware of my diabetes. So I was under control of diet and exercise. So it's only very recently I was diagnosed with diabetes type 2.
I was diagnosed with type 2 diabetes just over 5 years ago, and I was taking metformin for it until I fell pregnant.
I was diagnosed type 1 diabetic when I was 9.5 years, so I'm coming 30 now, so it's a wee while ago.
I was first diagnosed with diabetes whenever I was 10 years old, and since then I've had pretty good control. As a child I had excellent control because my parents would have helped me with different aspects of the diabetes, and then as I got older, when I was looking after myself, the level wasn't quite so good, but now I have good tight control because I'm pregnant.
I have type 1 diabetes. I've had it for 34 years. I was diagnosed when I was just coming on to my 6th birthday.
I was diagnosed with type 1 diabetes at the age of 2, just before my 3rd birthday.
If you're watching this, the chances are you know what diabetes is all about, and hopefully you know how to treat it. You'll know that it occurs when your body is unable to use glucose properly, which results in too much glucose remaining in your blood. You'll also know that insulin is essential to help control your blood glucose levels. Like most of the women we've heard from, you might have type 1 diabetes, which occurs when your body isn't able to produce any insulin. Or, like Aruna and DJ, you might have type 2 diabetes, where your body either doesn't make enough insulin or isn't able to use insulin properly. With both types, keeping your blood sugar levels under control is crucial, as is regular exercise and a good diet. That's hard enough at the best of times, but life could get a whole lot more complicated if it's not just you that you have to worry about. If you become pregnant, there's a number of risks you'll face and a series of steps you'll need to take to protect your health and that of your baby. And as babies start to develop before their mothers realise they're pregnant, those steps need to start before you even become pregnant. That's why it's absolutely vital that all sexually active women with diabetes plan ahead. If you don't want a baby, you'll need to ensure you have the right contraception. If you do, it's essential you plan your pregnancy with your diabetes support team. This DVD has been designed to give you the knowledge you need to take control of your life and ensure diabetes doesn't stop you living it to the full. We're going to talk about contraception for women with diabetes, the risks you could face if pregnant, and the ways to minimise them. Even if you're not planning a baby at the moment, it's important every woman with diabetes understands all the issues involved.
There is a certain pill for a diabetic. None of them agree with me anyway, but I wasn't on them and I didn't have any advice about contraception anyway before I got pregnant.
I would have said it was my 2nd pregnancy. The doctor then, the obstetrician then, he would have spoken more to you about, like the pill and things, because I was always told, diabetics don't go on the pill. And then I had happened to ask and he said, oh no, there's no problem, and was able to tell me which one and things like that.
I haven't been given any advice about contraception or anything like that by the doctors or the hospital. They just sort of say if you're needing it, you just ask and we'll tell you then. But when the time comes, they don't ever say, this is what it is and how to deal with it. So I've never been told.
If having a baby isn't on the agenda, or you're planning your pregnancy, the message couldn't be clearer. seek out advice on contraception. It won't come to you. Even if you're planning a pregnancy and your blood sugar control isn't as good as it should be, it's safest to find the right contraception so you can delay your pregnancy until you are ready. There's a good range of contraception options out there, at least one of which will be suitable for you, but there can be drawbacks if you choose the wrong one. So, make an appointment with your GP, family planning clinic, or a diabetes consultant for free confidential advice. There's no need to feel embarrassed. Doctors are asked for advice on contraception all the time. If it's difficult to attend an appointment, just call anytime. Your healthcare professional will always be happy to advise you. As a matter of fact, there are contraceptive pills for women with diabetes. You just have to be sure it's the right one for you. It's essential you discuss this with your GP, as some types can affect blood glucose and blood fats. You could also consider intrauterine devices, the diaphragm or condom, none of which affect your blood glucose. So don't worry, women with diabetes do have good options for contraception. You just need to get advice on the best one for you.
When I found out I was pregnant, I was in absolute shock. I contacted the diabetes team before I told my husband. I didn't eat or drink anything until I spoke to them. Yeah, I was really shocked. But once I spoke to them, they said, told me what I had to do, and I started insulin, and I got into the swing of things, and it was fine.
I don't know why it has to be planned. I think it might be because of your blood sugar and your injections and your food and diet and everything, but I don't actually know what the reasons are for planning it while you're diabetic.
And it's very important for diabetics to plan a pregnancy. There can be risks associated with pregnancy and diabetes, and it's important to plan it in advance, preferably with your team at the hospital, and to advise them possibly, I think it's recommended about 6 months to a year before you would become pregnant.
I think if I was going through this again, I would have planned it. I would have made sure that my HbA1c was within the range that they would like, which I think is below 6. And I think I would definitely try to do that before ever contemplating having another baby. Just because I think it then reduces the stress that you're under at the early stages, wondering whether your control has been good enough or not.
Oh, I would definitely plan for the next time, yes. Because I'm already aware what are the consequences and how good it is to be under control.
As Emma says, you really need to start planning months before you become pregnant. Making sure you're as healthy as possible before you get pregnant means you have a better chance of having a healthy pregnancy and a healthy baby. Your first step is to book in with your GP or diabetes team for a full MOT. For a woman with diabetes, that means an important checklist. You'll need to be sure your eyes, blood pressure and kidneys are in good shape. You might need to be taken off certain medication in case it's harmful to your baby, and it's vital your rubella vaccination is up to date. Your GP will also put you on a higher dose, around 5 milligrams of folic acid. As with all pregnancies, smoking can be harmful to unborn babies, and what better reason could there be to give up than wanting to have a baby? Although it can be difficult to stop, your healthcare team can advise you on your options and recommend ways to manage your cravings. Regular contact with your diabetes team is vital to ensure you have good control of your diabetes and that your HbA1c is on target. Your diabetes team will be happy to give you advice, so give them a call.